Hi, thanks for joining us. I'm Lindsay Groff, Executive Director at the Human Milk Banking Association of North America, and I am here with Lisa Stellwagen, a pediatrician and Executive Director at our member milk bank in San Diego. Hi, Lisa.
Hi, thank you for having me.
Yes. So I wanted to talk to you about the recent report from CDC about donor milk use in neonatal care units. So after reading that report, we discussed it a little bit. Could you talk to me about any surprises or your reaction to the report?
Yeah, I think this is the second time the CDC has included donor milk questions on their MPINK survey. And this is a survey that goes out to maternity hospitals in the country, across the country. Now it's voluntary to answer it. And because it's maternity hospitals, it doesn't include children's hospitals. So we have to keep that in mind as we think about what they found. But what they found is that the use of donor milk in this country has really increased in the NICU setting, especially in the level 3 and 4 units where they care for the tiniest and sickest kids. And that is just welcome news after we've had now decades of information about the importance of a human milk diet for babies. And so in some ways that was the surprise, is about how good things are looking. I think though the more complete story is, again, if you look at the sample selection and if you look at all NICUs, the picture isn't quite so rosy. And over all NICUs, only 60% are using donor milk for their clients.
Yes. Well, given that, what do we know about the supply of donor milk for these vulnerable babies who need it most?
You know, for many years, I think there was a limitation in milk supply on the milk bank side, but those days things have really changed. There's now 31 milk banks in all of North America. Last year, HMBANA Milk Banks dispensed over 9 million ounces of milk. There's a lot of milk out there. And so the use in the units is now becoming the breaking point, because I think the early adopters have been using it, some of them for 20 years, but there are a group of hospitals that haven't implemented donor milk. And that means that some very low birth weight babies are born and cared for a facility where if their mother's own milk runs short, they are not offered donor milk. And that could lead them to have a higher risk of primarily necrotizing enterocolitis. And that's a concern.
Definitely. So what additional data do you think we need to better understand these gaps in the hospital provision of donor milk, talking about the United States specifically?
Yeah, you know, I think I mentioned that not all hospitals are included in this survey. So having, a broader data set of all NICUs in the country would be great, covering all regions and all types of NICUs. And I think also the limitation the CDC had, and this is, again, questions they added into their MPINK survey. It's a very hard question to ask about donor milk use, because hospitals don't tend to track what baby got donor milk and how much they got and what was their initial weight. Really, hospitals only track in terms of human feeding what the baby goes home on, and it doesn't tell the complete story. And so I think if we can find a way to have NICU start collecting more, more clear-cut information about exactly what the baby got fed during the hospital stay, hopefully mother's own milk, but donor milk if there's a shortage, that will really help us figure out where to provide more support to see if we can't make sure that every baby has access.
Definitely, couldn't agree more. Despite what we know about the importance of providing donor milk for these very low birth weight infants, we know that many hospitals are still struggling to implement a donor milk program. But can you tell me some of the reasons that you think that is?
Yeah, I thought the report made some great comments about just that. Like, what is the problem at different institutions, and likely it's different at each institution. But they had a list of problematic areas that I thought was really good. One is availability of donor milk. We've already talked about that. That's getting better. The second was hospital leadership and administration being online. Even in some hospitals, the way milk is procured and the contracting process can be a problem. A lack of standardized feeding policies that make it really clear who has access to donor milk. Probably one of the biggest problems is just a lack of knowledge about the benefits and safety of donor milk, both on the hospital staff side and on the patient side. And until we bring all that base level of knowledge up to the same level, we're going to have a problem with adoption, either on the provider side or the family side. And I think that's something that we can all work together on.
Definitely. And speaking of which, we have something coming up. HMBANA is hosting a webinar on October 18th, and you are one of the speakers along with Kim Updegrove and Summer Kelly. So could you give us a little sneak peek about what you'll be discussing on this webinar?
Well, that little list was kind of my sneak peek. I mean, we'd actually come up with a list of things we wanted to talk about. How could we help hospitals that are struggling with adoption of donor milk? What kind of a framework could we provide, and give some insights into helping put, certain champions on your team? What kinds of toolkits might be helpful? And the CDC staff really listed a lot of those same things we were thinking about. So that's what the webinar is going to focus on. Just really first steps: how to get started, how to think about what you need to do, looking for champions, and we'd like to provide some practical tools that hospitals can use as they implement donor milk.
Great. So the webinar again is on October 18th, and you can register by going to hmbana.org to find out more information and to register. So just two more questions. What haven't I asked you that you think is important to know about the use of donor milk for hospitalized infants?
As welcome as this data was, that the use for many areas is approaching 90% of the NICUs using donor milk, there's still this big disparity in the United States, and it's just not right. It shouldn't matter where you have your baby. I always say in California, you shouldn't have to have your baby at my hospital in La Jolla to get donor milk if your child is born prematurely, and it should be available in any hospital. And I think we need to start setting that mark and telling that to our hospital administrators, and making sure that everybody brings up their programs to support current medical recommendations.
Yeah, I couldn't agree more. And one last thing, what are some other publications or references that people can learn more about the benefits of donor milk?
There are two good AAP references that are relatively recent. One about breastfeeding and human milk in the NICU for very low birth weight babies. And then just recently, the breastfeeding overall policy for the AAP that came out in 2022. And those both have references to donor milk use. But there's some other references that are really good. Academy of Breastfeeding Medicine has a document. The Surgeon General back in 2011 made a strong statement about donor milk for very low birth weight babies. And then the Health and Human Services every few years makes dietary guideline recommendations. And last year they published their updates, and there again was a section there about the use of pasteurized donor milk for the most fragile children. So I think having those documents and armed with that data and that standard will really help hospitals work with that environment. It's hard to change policy in a hospital, and it's best to gather all your information and approach it in an organized way. And that's one of the things we help to help people with in the webinar.
Great. Well, I'm definitely looking forward to that. And thank you so much for joining, Dr. Lisa Stellwagen, and we'll see you again on October 18th. Thank you.
Thank you, Lindsay.